Welcome everybody. Today I'm going to be going over some neck muscles here. A lot of you are dealing with neck tightness and stiffness in the neck area, neck region. And this is going to lead to a lot of problems. As you can see here, I have the animation kind of moving here, and it's highlighting the cervical flexion. And so basically this muscle right here is one of the muscles that definitely goes out when it comes to a lot of problems when you deal with just anything. Honestly, your emotions start to go down. You're dealing with problems with ETD, tinnitus. All these things can stem from the neck in itself, because let me tell you something, when the neck starts to become tight and it starts to become overworked due to poor posture, and several other reasons, diet, it could be not getting enough magnesium in your blood, could be all these different things that we could be firing problems off. So it's very important that a lot of you that are dealing with this issue, you really want to make sure to get this intact. So right now, we're looking at the cervical flexion. The cervical spine consists of 7 vertebrae going from the C1 to the C7, and it plays a crucial role in supporting and moving the head. So as you can see here, it is the most mobile segment of the vertebrae column. So as we can see here, cervical flexion basically refers to the anterior or forward bending of the neck. So a lot of you spend a lot of time looking down at your phones, putting a lot of strain on your neck. The average human head can be anywhere between 8 to 12 pounds, sometimes even larger or heavier than that. And when you continuously put this kind of pressure on those neck region muscles, you're going to feel it in multitude of streams, honestly. So we want to make sure that if you're looking down, we want to always try to do our best to bring our chin up. And then if we're on our cell phones, we want to bring our cell phone up, so that way you're not putting so much strain on those muscles. So let me go over to another portion. So looking up, cervical extension. So this is your cervical extension. And this is going to help keep just doing this. I wish I could put some labels on here for you. But what we're looking at here is, let me see if I can put a few labels on here. Welcome back, everybody. All right, so we have some labels now. Thank you for patiently waiting here. So I have some labels put on here. And when I was dealing with issues with my neck, issues basically with my upper body, it seemed like it was just falling apart. A lot of these muscles are starting to give out. We have tons of muscles here in the neck region, and we don't realize it. But when we do our cervical extension, where as we go back, it involves posterior or backwards bending. So, the neck. So during the extension, the vertebrae spaces of the cervical spine expand while compressing posteriorly. So when we're doing this, they expand. And so the primary muscles, some of these you can see, splenius capitis muscle is that's one of the biggest ones that I see is often tight. And that was the case for me. The splenius capitis muscle, let me move this over here, was often tight a lot of the times when I had issues with trying to get my neck back in check. But a lot of you that are dealing with eustachian tube dysfunction or tinnitus, and you're just trying to figure out why is there not more on this x-ray? Why is there not more that the doctor's seeing in my ear? Why? All these questions, why? A lot of times it's muscle related, it's structural related, it's jaw related. It has a lot to do with all these issues. And so if these muscles are starting to fire out with inflammation, or they're just giving out, let's go into a different position. You're going to have problems with the ear. It's proven. And so right here is a position. Let me move some of these out of the way so you can see. Get out of the way. Here, the scalenes are very important. The scalenes are a little bit down here. Scalenes are one of the muscles that starts to really give out a lot of problems. And basically this is called cervical lateral flexion. So basically side bending, sideways tilting of that matter. During lateral flexion, the cervical vertebrae tilt towards the direction of bending, resulting in intervertebral spaces compressing on that side and expanding to the opposite side. And so the primary muscles are, as you can see, is the scalene, the anterior, the middle, and the posterior scalenes. And so if you're not taking time to adequately stretch, you're going to have problems with the ears, you're going to have problems with the neck, and this is going to start weighing in on your mood in general. You're going to start feeling a little depressed, you're going to start feeling a little moody, just because the neck is not doing what it should do and at a smooth rate. So you want to be sure if you're having these problems, this is one of the things that can really go wrong. And so You got the levator scapula, this sternocleidomastoid muscle. I think I moved the sternocleidomastoid muscle out of the way. Uh, Somewhere. There we go. SCM. You've heard a lot of people talk about the SCM muscles. The SCMs can tend to get very fatigued very quickly, and it also reduce the range of motion. And so, if you're having these problems with the neck, ladies and gentlemen out there, I want all of you to understand something, that before you start to really look at all these products that you're taking, you start to really panic about what's going to work. Start going back to the basics. Look at the muscles around. I'm just showing you like through 3D here, but a lot of these muscles are the problem. These are probably most likely the problem that you're probably having with your ears. Not just your ears, but just your mood in general. It's proven these muscles are correlated and connected to a lot of areas of the skull, the brain, going up to the neck. A lot of problems with mood can come from just having a stiff neck, having muscles not be where they should be. They're not having that elasticity. And so these are very important things that you keep in mind if you're dealing with issues with not only just eustachian tube dysfunction, but just issues of the neck in general, not getting good range of motion. Taking time to stretch the neck, simple stretches is really what's very important. You'll be surprised how powerful just taking time to do simple stretches is really going to help the body in general feel so much better. And I think if you concentrate on the structural part of the body, the anatomy of the neck, the jaw, the TMJ joint, you're going to find some tremendous results when it comes to healing from ETD and areas related to the ear. So I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the J1 studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody, and I will see you in the next video.